Hi, I'm Dr. Peter Cocolis, and I wanted to sit and talk to you about oral cancer screening today. I did another video about it's not just a cleaning, to talk about the different parts of our exam. But the other day I was doing an exam on one of my teenagers, one of my teenage patients, and he turned to me and said, "Hey doc, can you just do the normal dental thing, please?" Because I was doing an extra oral cancer screening, and I was starting to look around. And it made me realize that everybody still thinks that all we really do is look at teeth and gums. And while that's an extremely important part of what we do, and a major part of what we do, making sure that the teeth are healthy and that the gums are healthy, we're also taking a look to make sure there's no signs of infection or cancer anywhere in the oral cavity or around that. We look both extraorally and intraorally. Extraoral means outside. We're palpating lymph nodes and glands to make sure there's no lumps, bumps, or anything unusual. Those could be signs that you've got cancer or infection deeper in the tissue that your body is trying to fight. We go ahead then and move into looking in your mouth. And we look at the cheeks, the tongue, the lips, the palate. We're looking for white spots, red spots, lumps, bumps, or anything unusual, anything that doesn't look right. Little ulcerations, anything. And those things could be something as simple as a little bit of trauma. You had a potato chip that hit you in the roof of your mouth. Or you had a little pizza burn. But something that lasts longer could be a sign of something more dangerous, oral cancer. The second way we look around is we use the Velscope, and that's what this is. And it uses the body's natural luminescence with light to help us see deeper in the tissue. And what this does is it helps us see any dark areas. Dark areas would be increased cell mass, or increased blood flow. And those could be both signs of infection or cancer that's deeper in the tissue that I can't see otherwise, but we can catch it earlier. Because earlier detection leads to easier treatment. Well, why is this important? And you said, Doc, you were looking at a teenager. Why is this important? Well, we've seen an increase in incidence in oral cancer in our age groups from 13 to 35. What they're finding is that there's a correlation with human papillomavirus. So that age group is more at risk, even with no other risk factors. So it's important to come in, get your dental exam, and have your oral cancer screening. And so don't forget, come on in and see us, get your exam, and we'll do it in both ways. All right, and if you'd like to give us a call, 703-912-3800, or check us out on our website, www.smiles4va.com. Thanks.